Under the work health safety regulations, persons conducting a business or undertaking are required to eliminate psychosocial risk, and where that's not reasonably practicable, minimise those risks as so far as reasonably practicable. So in regards to that support and what MTA has developed to support those obligations, we have launched 2 psychosocial safety and wellbeing courses. One has been developed for the workforce and one has been developed for leaders. And these courses can be used as a risk control measure in regards to those obligations for employers. The workforce course has been tailored to the rail industry via industry training needs analysis and consultations. And the leadership psychosocial risk management course has been developed by Shehan and Bond University. Both courses align with the Safe Work Australia Model Code of Practice and Managing Psychosocial Hazards at Work, which support the work health safety regulations used across Australia. So the first course that we've launched is the Leadership in Psychosocial Risk Management, which is a micro-credential course designed to accredit supervisors, managers and leaders. It also focuses on building capability to lead and manage psychosocial risk at a team and at an organisational level in accordance with those Safe Work Australian guidelines. In regards to the course program, participants who complete this course will learn how to identify and assess psychosocial hazards within their teams, recognise signs of work-related stress and behavioural change, apply practical strategies to support effective communication and team engagement, promote a proactive approach to psychosocial risk management, build team and organisational resilience, and respond appropriately and effectively to psychosocial risks and incidents. And the other course MTA has developed and launched is the Psychosocial Safety and Wellbeing at Work course. So this is a micro-learning program for all workers, and it focuses on building individual awareness and practical risk assessment skills to identify psychosocial risks in the workplace. And it has also been tailored to the rail industry via those industry consultation sessions I mentioned earlier. In regards to the course program, participants who complete this course will learn how to understand psychosocial hazards and their impact on safety and wellbeing, recognise early warning signs and changes in behaviour, build confidence to check in, speak up and support others, apply practical strategies to reduce risk and prevention and harm, and understand their roles in contributing to psychosocial safe workplaces. To support the rail industry, we have also released a catalogue of online courses spanning across cybersecurity, digital safety, health, wellbeing and mental fitness, privacy, data protection, information handling. Sorry, my slide hasn't changed. Respectful and inclusive workplaces, risk management and assurance, and work health and safety compliance. And of the benefits about completing one of the courses that have been launched by MTA is that they've been designed to be flexible, fully online and scalable across the whole industry. They're also aimed at reducing operational downtime by allowing workers to complete that training online without the worker needing to be pulled off the job. It's also cutting down any administration burden for administrators because they no longer need to upload certificates and so forth. Once that training has been completed, these competencies are uploaded directly in real time onto a worker's RIW profile with no manual verification required. That's because it's coming from the source of truth, so we eliminate that need for any manual verification. Both RIW card holders and non-RIW card holders are both able to complete these courses. The companies or individual workers can enrol learners through the MTA training website, or organisations can also assign the training directly as an e-learning through the RIW system, and I'll touch on that a little bit later. The competencies can also be linked to an employer, network or national job role, which really allows for organisations to set these requirements as prerequisites to a role and provides administrators the ability to easily track that compliance. Any training from our e-learning library can either be purchased as an enterprise solution to support onboarding, safety and compliance programs, or it can just simply be purchased as a per person basis, depending on those business needs. And lastly, with interoperability being such a strong focus across industry, once these competencies are recorded on a worker's RAW profile, they essentially become portable across employers and networks. And that really just helps reduce any duplication in retraining, and all those unnecessary costs that are related to any retraining. So to access any of these courses, you can simply visit the website you can see here on the screen, and enroll in any course that you may select on the website, or you can head into RIW and find the e-learning tab. Once you've found that e-learning tab, you can actually just search the keyword MTA. That will bring up a list of all the MTA courses in a drop-down list, and you can select any of those courses and assign them directly to your workers. The workers will receive an email to log in and complete that particular course, and on completion, that certificate will upload directly back onto that worker's RIW card. Alternatively, if you're interested in implementing any of these courses as part of an enterprise-wide solution, feel free to reach out directly to myself and we can discuss what that might look like for your organization as well.
Cover with you today was the risk assessment process, a hierarchy of control strategy, and integrating MTA learning solutions, which Stacey has kindly talked to you about right at the front end of this session, which is great, but we will circle back to that and answer any questions as well. About why we're doing this, I want you to go back to our hierarchy of control model. Can I give some of us who have safety backgrounds, this will be really familiar. For those of us that might have P&C backgrounds, this might be really familiar in the P&C context and not so much in safety. But what this really highlights to us, and this is I'm just using a WorkSafe hierarchy of control, and there's many models out there, is that the number one priority for us is like, how do we eliminate this hazard in the workplace, right? So is there a proper way to eliminate every hazard in the workplace? Probably not, right? But there are areas of work which we've done extensive work on things like bullying and sexual and gender-based harassment, and a whole range of programs where, you know, we as a community of practitioners have moved to eliminate those risks within the context of work. What we're trying to really focus on within our controls of psychosocial risk is, are we managing the work that's been done? Are we managing the plant or the environment? Are we managing the systems and the design in which work is developed? So if we think about some of the critical controls, we definitely need awareness and training for our leaders, our workforce around coming into a workplace and understanding that they may be exposed to different psychosocial hazards, being able to look around and see what those are and the risk to them, and make sure that they intervene early to mitigate the risk of harm. And that's what the programs that Stacey was talking about really refer to. But if we move into that middle area where it's reducing the risk by altering, we can't necessarily rely on our workforce to manage work that's allocated, manage the systems of work or the way that work is designed, right? So we really need to push into that space. So let's get a bit of a read in the room of where people think they sit, right? So remember that if we don't know which of the psychosocial hazards that we're targeting, and then we've just built a risk registry and have all these controls that have just been mapped against that, it becomes very hard for us to assess control effectiveness, right? Essentially, all we've done is just taken, you know, a whole range of risks and thrown like hazards and thrown a whole range of risk controls up against them, but we're not going to be able to move to step 4, which I'll show you shortly, which is around measuring and evaluating the effectiveness of those. What does step 3 look like? And some of you may have seen this before, but step 3 helps us actually operationalize the control of risk. Now, here's an example from WorkSafe that I'm throwing on the screen, and this is just WorkSafe's prevention plan template. So, you know, hopefully this can be a tool, as a free tool that people can download. But part of our program of works that we're doing with MTA is helping organizations operationalize this. It may look simple to fill in, but once you start working through it, there are certain levels of consultation that validate this. And that's where MTA has been working hard to sort of build that capability, be able to deliver some of those risk controls. Step 3 also leans on a hierarchy of control. So what we've done here is provided an example from New Zealand, because I think this is a really great way to think about whether we're focusing on changing the work or changing the worker. We need to go more into the design of the redesign of how work is done, including roles, responsibility, and the environment. And we also need to think about how we make adjustments to existing practices, right? So for us, if we're thinking of this in a parallel to safety, redesign is sometimes substitution, right? And that's the language that's used in a physical hazard. And then isolate engineer is adjust, make adjustments to existing practices, substitute tasks with safer alternatives, or increase resources to meet demands, right? So these are very simple, practical ways to look at how you manage your controls and what control effectiveness looks like. Step number 4, okay, review and evaluate. So one of the last steps that we need to consider is, what's our approach to review and evaluation? Are we consciously thinking about the experiences of people that are going through these traumatic experiences and adjusting our controls to be as effective as possible with them? So if we're trying to control the risk of intrusive surveillance, then we would be looking at controls that are aligned to wearing body cams and or surveillance within the settings that we work at, or how surveillance is even communicated. If we're looking at organizational change, we'll be looking at effective controls that measure change engagement. If we're looking at trauma, we're looking at, like Lee has shared, people's skills to provide trauma-informed care at the onset of a crisis. So, back to that question, it does vary across every one of the psychosocial hazards. Some of the anchoring controls are going to be things like your leader training and your workforce training that just get the awareness and the administrative pieces out initially. So